Let's talk about abnormal Pap smears. What is a Pap smear? Many of us think that the pelvic exam that we have with our doctor on an annual or every other year basis is a Pap smear itself. But a Pap smear is actually a specific screening test where your doctor will collect some cells from on your cervix to be looked at under a microscope. The reason we look at these cells under the microscope is to determine if they look abnormal, much like an abnormal mole. You can see an abnormal mole and we think, oh, maybe I should have that looked at by a doctor. But you can't see your cervix, and so someone needs to look at it for you. When we look at your cervix and collect those cells, we get a report, and that is the Pap smear. The Pap smear tells us if it looks like there's any abnormal cells on your cervix. The most common cause for abnormal cells on your cervix is the HPV, or human papillomavirus. Most of us will have one or more HPV virus infections in our lifetime if we are sexually active. And most of us will cure that virus on our own with our own immune systems within a year or two or several. However, if you're somebody whose body has not been able to clear the HPV virus infection, it can and will target the cells on your cervix. And that is why we collect Pap smears, so that we can find this early and treat it as minimally invasively as possible. So now you have an abnormal Pap smear. What do? We would love for you to come see us, Dr. Hobson or myself, and we will talk to you about what is abnormal on your Pap smear or how abnormal is your Pap smear. And then often we will do a procedure in the office called colposcopy. That's a big word for we look at your cervix with a microscope. During that exam, we can then collect biopsies or small pieces of tissue from the cervix that will help us better understand how abnormal are the cells and how worried do we need to be. Once we have a biopsy and we know exactly what is abnormal in the cells, then we can talk about options for management of your abnormal Pap smear and abnormal cells on your cervix. Sometimes that means just watching and waiting for your immune system to help get rid of those abnormal cells. And sometimes that means we offer removal of the abnormal cells on your cervix with a procedure called a loop electrode excisional procedure, or LEEP. With a LEEP procedure, we remove a small piece of your cervix that we hope to contain all of the abnormal cells. This will hopefully treat those abnormal cells by removing them completely. Again, much like having an abnormal mole removed. We want to remove all of those abnormal cells. After a LEEP procedure or any abnormal Pap smear or abnormal findings of your cervix, it is very important for you to continue following up with your gynecologist or your doctor who is helping you with that problem. After a LEEP procedure or the finding of any abnormal cells on your cervix, it is very important for you to continue following up with your doctor or your gynecologist to make sure that the abnormal cells stay away, and if they return, that we find that early. It is very important in your life to have regular pelvic screening exams, to have regular Pap smear screening, because this is a problem that we can find early and treat easily. Again, I want to invite you to come talk to myself or Dr. Hobson about any abnormal Pap smears you have had, because it is so important to have follow-up. The reason is that abnormal Pap smears and cervical dysplasia can progress into cervical cancer if not carefully followed up or if not appropriately treated. So please come talk to us.